I'll now like to move on to the next part of our talk, which is bathing of the mobile elderly patients. So what we were asked to do is a very simple study. The question that was proposed to us is, does the storm shower chair reduce the rates of urinary tract infections in the nursing homes? This analysis was done by Kimberly Hart, who was supported by a diversity fellowship, and myself, Dr. Beck. So the first question is, what are these shower chairs, and why do we think they may make a difference? When we look at the shower chair here, you can see your standard 19th century design. We got ourselves your standard little toilet seat, and you sit on it. When we look at our 21st century design here, you can sit on the seat here, and you could potentially wash the patient from front to back because you can actually reach your hand in there. And we have a disinfection cabinet, and we'll discuss these points over the next few slides. First of all, the traditional shower chair has poor access to areas that are commonly soiled. Every nurse in this room knows one simple rule absolutely. Wash the patient from front to back. All our training teaches us to do this. You can't do it. You can't reach in to the front of the patient's perianal region here and wash to the back. You can't even reach all the way to the back if there's feces on the top of the buttocks here. You cannot have proper washing method. It is simply not possible, and this is unacceptable. When we look at the traditional shower chair and male patients, the male patients sometimes scream quite loudly when they're told to sit on these chairs because things get caught on these little plastic bars and toilet rings on the way into the chair. This makes the bathing experience more unpleasant for everyone involved, and it's already unpleasant enough. Who here wants to be bathed by a complete stranger? No one. So, it's a serious problem here. Also, when we look at the potty pail is typically attached directly below the toilet seat. When you have a larger patient sitting on this toilet seat, there might be flesh hanging down there, and male patients, there's always flesh hanging down there. And when I move this toilet seat in and out from underneath the potty chair, we're going to be touching skin. This is going to be a source of cross-contamination between patients, and cross-contamination between patients here could mean movement of multi-drug resistant bacteria, which are a huge problem we need to avoid. When we look at the reclining shower chair systems, there's the storm shower chair system and the MGM reclining shower chair system shown here. Water flows away from the urethra. When I bathe this patient and I spray them with water, the water is going to flow from the front to the back. That is critical. That is not going to happen in a patient sitting upright in a potty seat because the water will pool on the bottom, which particularly in the female patient means on the urethra as well. Here it shows the bathing of a patient in a traditional shower chair. The first thing to note here is the red arrow. You can't access the front of the patient. There's skin in the way, the legs are in the way, the toilet seat's in the way. You do not have access. When we look at the green arrow, this is the patient being bathed by the nurse. This is not to pick on the nurse here. There's a simple access problem. If I don't have access, I can't use proper technique. So what technique are we going to use? We got the front to back method being demonstrated here. Front to back, back to front, front. Oh boy, we just got cross-contamination city as we go back and forth, back and forth, back and forth. Often we also use a circular motion. Get under there and wash as best we can in a circular motion. Both of these methods are going to severely contaminate the urethra with fecal bacteria. The blue arrow shows that also that water is flowing up. When the patient is sprayed underneath by the nurse, you got to get the hose under there and spray the patient. The water's coming straight up, moving bacteria again from the back to the front. And we've all done this with a water hose. You take the water hose, spray the leaf all over the place. You can spray the leaf all the way across the driveway with a water hose. How much more so for bacteria, which are much smaller than those leaves in our yard. So it is not possible here to bathe the patient properly in a traditional shower chair. Let's look at the split seat reclining shower chairs. They're open front to back so that you can wash from front to back. The seat is spreading. I'll show you that on the next slide. And it is a reclining position so water flows away from the urethra. So the first thing is, male patients sitting in the storm shower chair. It is nothing in the way. They can actually sit down without being traumatized. A lower bedpan also prevents cross-contamination between patients because the skin of the patients is not contacted directly by the bedpan. When we look at the seats, as you sit in the seat will spring load and spread a little bit. And when you're washing patients that have the Grand Canyon down there, and some of our patients have quite a canyon for that area, then we need to spread that canyon open so that we can actually reach in there and bathe the patient, because we need to get all the skin clean. Otherwise, the patient may have bed sores develop, etc., due to improper cleaning. Okay, so the shower chair will allow you to spread the butt cheeks just a little bit so that you can have better access to the patient. When we look directly underneath the shower chair, quite the opposite of the bird's eye view here, you got access. I can wash the front, I can wash the back, I can start at the front, and I can work all the way back and wash whatever else happens to be in the way. Okay? This will prevent contamination of the urethra during bathing. And finally, it also allows bathing. It also allows diapering of the patient while they're in the chair. So the patient is sitting in the chair, and if we have a standard diaper like the one shown here, we can actually put the diaper on while they're in the chair. So when we look at critical advantages of the split seat shower chairs in reducing contamination, what you see is you can wash front to back. That is absolutely critical. That is the number one thing you're supposed to do when bathing a patient. Wash front to back. You have open access, so you can actually wash all the area. And you can access that Grand Canyon down there because the seat will spread. Reclining position will promote the water to naturally flow front to back as long as you don't shoot the hose from the back to the front. You control the hose carefully. You can make sure the water keeps flowing front to back. And you can diaper the patient on the chair. We'll discuss this later in the talk. The bottom line is the fewer the number of surfaces contacted by the patient, the less cross-contamination will occur. It is essential we reduce the number of surfaces contacted by the patient while they are unclothed. Okay, so this will reduce also accidental slips and falls due to reduced movement while the patient is wet. So, onto this study. The question was, does the introduction of the storm shower system reduce rates of urinary tract infections in nursing homes? There's two comparts to this system. There is the split seat shower chair and critically a disinfectant system. Now, when we look at patients sitting in a shower chair, this is something to consider when you consider your bathing protocol for patients, which we'll discuss at the end of the talk. Patients, they get wet, and they often poop or pee when they're wet. This happened to us when we were a baby. We've all bathed little babies, and they pooped while we were giving them a bath. The elderly, sometimes they do this as well. It's very embarrassing, but it happens. Okay? Don't be upset with the patient. It's a very natural human event. So you can purchase a containment tower. This containment tower is secured to the floor so that the feces is caught in the tower and only small matter will go down the drain and the water can flow around it. Or you can simply take the potty pail off the shower chair and slide it under the patient before giving the bath. You do not want the patient pooping on the floor. You're going to walk on the floor. when you're walking on the floor, you do not want to be putting feces in your shoes. You don't want to be grinding feces through the drain out of frustration because they pooped on the floor and you don't want to pick it up. You want to have the poop in something you can contain it in, and then put it into the toilet and flush it down nicely. Okay? The disinfectant cabinet, we'll discuss this later, but it is critical to have increased emphasis on chair disinfection between patients so that we can make sure that the chair they're sitting in is clean. Okay? So the study methodology is very simple. We went to Storm and Associates. We opened up their file cabinets quite literally. We went through the file and said, who bought your chair? It's a very simple question. How many chairs did they buy, and when did they buy them? We then took that data back to the office, and we went to the nursing home compare database and collected information for urinary tract infections before and after the introduction of the Storm shower chair. We compared 4 quarters before and 4 quarters after. That's a full year. Or we compared a year and a half before and a year and a half after. Now, when we look at this, and analyze of the invoice data, we found 93 nursing homes that had 4 quarters pre and post, or we had 82 nursing homes that had 6 quarters pre and post. We divided the nursing homes into 2 groups. The first group was nursing homes that bought 2 or more shower chairs. The second group was our control group, nursing homes that only bought 1 shower chair. Presumably, nursing homes that bought only 1 shower chair are buying this as an additional shower chair to replace one of the shower chairs they already have in their facility, whereas nursing homes that are buying multiple shower chairs may be replacing all the shower chairs in their facility. We have not controlled for any other confounding factors. We only have invoice data and urinary tract infections. How many chairs they purchased and when. So if we compare the urinary tract infections in nursing homes that bought more shower chairs, what we see when we look at 4 quarters pre and 4 quarters post purchase of the shower chair, we see a 1.2% reduction of the rate of urinary tract infections in these nursing homes as a group. That is statistically significant. If we look at reduction after 6 quarters, we see a 1.6% reduction in the urinary tract rate, infection rate in these nursing homes, which again is very significant. And there was no change in the urinary tract infection rate in the nursing homes with only 1 shower chair. Okay? Presumably, if we had better compliance or were able to assess the compliance of these nursing homes with cleaning the shower chair, and etc., these numbers would probably even look more significant and larger differences could be seen. Okay? The bottom line here is that there was a significant reduction with 2 or more shower chairs, both 4 quarters after and 6 quarters after the introduction of the shower chair. We also looked at incontinence and the percent of patients with incontinence in the nursing homes. And again, what we saw was there was a significant reduction in the nursing homes with a 5.8% reduction in the rate of patients who were incontinent if the nursing home had 2 or more shower chairs versus a small change that was not significant if they only had one shower chair. And again, a 6.1% reduction in nursing homes with 2 or more shower chairs for 6 quarters post, and no difference basically seen when they did not when they only had 1 shower chair. Okay. Now we consider incontinence. Incontinence is a potentially confounding factor because incontinence does somewhat control with urinary tract vary with urinary tract infections, but the patient population in these nursing homes should not dramatically change as a group when we're looking at large numbers of nursing homes 4 quarters before and 4 quarters after the introduction of the shower chair. The patient population should, on average, over multiple nursing homes, be basically the same. So the percentage of residents that are incontinent should be basically the same over that period of time. And if they decrease, that should be due to the shower chair. And it's important to note that incontinence is frequently a symptom associated with asymptomatic urinary tract infections, suggesting the shower chair helped reduce the asymptomatic rate of infections, of urinary tract infections, even more than it reduced the rate of symptomatic urinary tract infections. So in conclusion, there was a significant reduction in urinary tract infections in nursing homes using 2 or more split seat reclining shower chairs, both over a 12-month and 18-month period, and there was a significant reduction in incontinence in those nursing homes when they used these shower chairs. Obviously, we'd like to do future work. We would like to verify that the population did not change significantly, and Kimberly's analyzing that data. And more importantly, we'd like to do an intervention study where we can actually control for variables such as compliance with the bathing protocol and such, assess patient perception, staff perception, additional medical and quality of life indicators besides these simple ones, and control for confounding factors like bathing practices and the whirlpool baths in the nursing facility, and get a more